Welcome to Pregnancy Focus. This episode covers your first antenatal visit, a critical step in ensuring a healthy pregnancy. The first visit confirms your pregnancy, evaluates your overall health, and identifies any potential risks early. You'll also receive the Maternal and Child Health Record Book, an essential guide for tracking your health and your baby's growth. Early and regular antenatal care is the key to a safe and healthy journey through pregnancy. Are you ready? Let's dive in. First antenatal visit. It is important to visit your midwife or doctor for regular checks when you become pregnant. Your first visit should be as soon as you realize or suspect you are pregnant. This first visit will provide you the opportunity to confirm you are indeed pregnant and to check on your general health. The health check on you at this early stage is very helpful for detecting if you may be having problems later in the course of your pregnancy. The health care provider, midwife or doctor, will tell you when and how often you are recommended to come to ANC. Maternal and Child Health Record Book. The Maternal and Child Health Record Book, MCH Record Book, contains records of mother and child's health growth and development up to 5 years of age. It has information on how to maintain and care for the mother and the child. You will receive one MCH record book at the first ANC. If you deliver twins, triplets or more, you will receive additional MCH record books for each child. MCH record book tells you what services you need to take and when you need to visit health facility for the next care. Please take the MCH record book along with you anytime you visit the health facility. Please read the MCH record book with your partner and family members. It contains health information for the entire family members. Feel free to ask health care provider if you have any questions. Visit health care facility immediately if you notice any danger signs. Please keep the MCH record book well and safe because it contains important health information on you and your child. You may need it in future for the next future pregnancy, when you or child is unwell, child's schooling, or use for traveling purposes. Normal pregnancy. Current pregnancy. Much of the following information will be asked by your midwife and be written in the Maternal and Child Health Record Book, Family Identification. The following questions will be asked by your midwife: name, date of birth, age, address, landmark, subdistrict, district, telephone number, region, marital status, educational status, occupation, spouse's name, spouse's date of birth, spouse's age, spouse's address, landmark, district, subdistrict, region, spouse's telephone number, spouse's educational status, occupation of spouse, name of emergency contact person, telephone number for emergency, telephone number for emergency transportation. Obstetric history. The following questions will be asked by your midwife: number of pregnancies, including the current one, number of births, number of abortions, spontaneous or induced, date of delivery or pregnancy lost, place of birth of child, problems during the pregnancy, gestational age at birth, mode of delivery whether CS, SVD, outcome of delivery whether live birth, stillbirth or miscarriage, labor and postpartum complications, sex of baby, male or female, birth weight, child present health, good, poor or death, infant feeding. The following questions will be asked by your midwife: did you breastfeed your last child? Did you exclusively breastfeed your last child? If yes, how long? If less than 6 months, what was the reason? If no, what was the reason? Duration of breastfeeding? Medical and surgical history. Is there any personal history of the following: hypertension, heart disease, sickle cell disease, diabetes, epilepsy, HIV infection, respiratory disease, TB, asthma, mental illness, allergies, drugs or food, Medication history. Previous surgery. Social history. Is there any personal history of the following: alcohol consumption, smoking? Family history. Is there any family history of the following: hypertension, heart disease, sickle cell disease, diabetes, multiple pregnancies, birth defects, mental health disorder, records of current pregnancy? The following questions will be asked by your midwife. First day of the last menstrual period, LMP. The type of contraception used before this pregnancy, if any. Height. Laboratory investigations. You will be asked to do the following laboratory investigations: blood group, rhesus typing, HBs AG hepatitis B G6PD glucose 6-phosphate dehydrogenase deficiency, VDRL, syphilis, HIV antibody, VF for malaria, HB hemoglobin, urine Re, stool Re. Other checkups. The following checkups will be run on you: ultrasound scan, weight, BP blood pressure, fundal height, fetal heart rate, presentation of the fetal head, descent of the fetal head, vaccination. You will be scheduled to take 5 doses of tetanus diphtheria TD. Intermittent preventive treatment, IPTP, for malaria will be taken for 5 times after 16 weeks of gestation till delivery. Long-lasting insecticide-treated net, LLIN, will be supplied for you. Helminthiasis will be treated after 16 weeks of gestation. Counseling. You will be counseled on the following topics in the first trimester: how to use the MCH record book, importance of COC, how to use the COC card, purpose of antenatal care, diet and nutrition, anemia, IFA supplement, malaria prevention, rest and exercise, personal hygiene, mother-to-child transmission of HIV, danger signs in pregnancy, drugs and substance abuse. Additional topics. You will be counseled on the following topics in the second trimester: pregnancy-induced hypertension, PIH, diet and nutrition, anemia, IFA sup, sexual activity and safety, sex, birth preparedness, complication readiness and support person. Additional topics. You will be counseled on the following topics in your third trimester: signs for labor and progress of delivery, neonatal care and danger signs in newborn, immunization schedule for baby, diet and nutrition, anemia, IFA supplement, importance of postnatal care, breastfeeding and breast care. Additional topics. Minor disorders. These are common disorders or major discomforts that women experience during pregnancy. Majority of the discomforts experienced during pregnancy can be attributed to either hormonal changes or the physical changes related to the growing uterus. The following are some minor disorders or common discomforts experienced during pregnancy and how to manage them: nausea and vomiting, morning sickness. Causes. This is due to influence of gonadotrophic hormone on the gastric juice in the stomach around 4-8 weeks of gestation. Psychologically. Getting out of bed suddenly. Increased ketones in the body disturbs metabolism. Food. The scent of certain cooking foods. Smooth muscles relaxation or decrease stomach emptying. Vitamin B6 and zinc deficiencies. Management. Rule out conditions like malaria and worm infestations. Get out of bed slowly. Avoid of trigger foods and tight clothing that constricts the abdomen. Use relaxation techniques such as slow, deep breathing can help to decrease nausea. Take dry foods such as biscuits to mop up secretions, less fatty foods to prevent indigestion. Adhere to small, frequent meals. Remain in an upright position after eating. Drink fluids between meals. Avoid spicy foods. Heartburn. Results from the reflux of acidic gastric contents into the lower esophagus. Causes: progesterone-induced relaxation of the cardiac sphincter and delayed gastric emptying. Reflux of remains of stomach contents into the esophagus. Compression of enlarged uterus on the stomach. Management: eat small more frequently. Avoid fatty foods. Avoid bending over or lying flat after meals. Remain in an upright position after meal. Sleep in a prop-up position with extra pillows to alleviate nocturnal heartburn. Take antacids for relieves.